Have you ever dismissed a minor yet persistent change in your body simply because you believed it was an inevitable part of the aging process? Perhaps you observed some light spotting many years after your last period had ended, or maybe you experienced a new and unfamiliar cramp in your lower belly and simply wrote it off as something ordinary and unremarkable. For women who are over the age of 50, it is incredibly easy to make the assumption that any unusual symptoms are just a normal part of the natural process of getting older. But sometimes, these very small and subtle signals are actually your body's way of gently whispering to you that something of great importance requires your immediate and undivided attention. When it comes to the subject of gynecologic cancers, such as ovarian, uterine, cervical, or vulvar cancer, the earliest signs of these conditions are often incredibly subtle. They can be very easily overlooked, they can be ignored, or they can be profoundly misunderstood. And yet, the stark reality of the matter is that the act of catching these particular types of cancers at an early stage can in fact save lives. Hello, I am Dr. Lily Stones. For more than 3 decades now, I have had the profound privilege of caring for women at every single stage of their lives. And in that time, I have been able to see firsthand just how a sense of awareness and the act of taking early action can make a truly tremendous and a life-altering difference in one's overall health outcomes. And my mission here with you today is a very simple one. I want to be able to walk you through 7 of the most common early warning signs of a gynecologic cancer that women who are over the age of 50 must absolutely not ignore. And by the end of our time together today, it is my sincere hope that you will be able to feel so much more informed, so much more confident, and so much more empowered to be able to take complete and total control of your own personal health. The act of gaining knowledge is one of the very greatest and one of the most precious gifts that we can ever possibly be able to give to ourselves and also to all of those whom we so deeply and so dearly love. But before we dive in, I would be so honored if you would please take just a moment to be able to subscribe to this particular channel. Here at Elder Care Wellness, we are deeply and profoundly committed to being able to create the kind of content that is medically trustworthy, that is completely and entirely evidence-based, and that has been specifically and carefully designed for women who are just like you. And we are also deeply and profoundly committed to being able to talk about all of the very real and of the very important issues that are able to affect your own personal health. And we are also deeply and profoundly committed to being able to do it in a way that is both so very clear and so very compassionate. And I would be so very honored if you would please join us in this very important and this very integral conversation. And if you have ever been able to notice for yourself any kind of a change in your own body and have then been able to wonder to yourself whether or not it was normal, I would be so very grateful if you would please be sure to leave a comment down below. And I would so truly and so deeply be able to value the opportunity to be able to hear your own personal story. And please know that sometimes the very same experiences that you are able to share can be able to help another woman to be able to recognize something very similar in herself. So, let's go ahead and begin with the very first and the very most important sign of all, the experience of an abnormal form of a vaginal bleeding. If you are already in a post-menopausal state, which simply means that you have not at all had a period for at least a full 12 months, then please know that any kind of a vaginal bleeding at all is not at all normal for you. And this is able to include even the very lightest and the very faintest form of a spotting. And the American College of Obstetricians and Gynecologists is able to emphasize the very fact that any kind of a bleeding that is able to occur after the onset of your own menopause should always and at all times be evaluated by a professional healthcare provider. And while there can, in fact, be a host of different and distinct non-cancerous causes for this particular issue, such as a simple and a pure thinning of your own vaginal walls, or the presence of some very benign and of some very harmless growths, such as some polyps, the experience of a post-menopausal bleeding can also, in fact, be a very early and a very important sign of an endometrial or of a uterine cancer, or of a less commonly occurring form of a cervical cancer. And for all of the many women who are still in the process of transitioning through their own menopause, the experience of an abnormal form of a bleeding may be able to look a little bit different. And perhaps you have begun to notice that you are now having some much heavier than usual periods, or you are now having some bleeding in between your own periods, or you are now having some menstrual cycles that have suddenly and unexpectedly become so very irregular, after many, many years of a complete and of a total predictability. And while all of the many different and distinct hormonal fluctuations are, in fact, a very common and a very normal part of the process of a perimenopause, any kind of a significant and of a dramatic change in your own personal bleeding patterns should never, ever be ignored. I would like for you to please try to think of your own uterus as being like a very reliable and a very predictable tide. And if that very same tide is to suddenly and unexpectedly begin to come in at some very odd and at some very unusual times, or if it is to suddenly and unexpectedly begin to come in with a much greater and with a much more powerful force than it had ever had before, then that is your very own body's own personal way of being able to tell you that there is something that is in need of your own personal attention. And one of my very dear patients, whom I will be sure to call Anna, had once been able to teach me a very unforgettable and a very powerful lesson. And she was 61 years of age at the time, and she had already been in a post-menopausal state for nearly a full decade, when she had then begun to notice just a few small and of just a few simple drops of a blood on her very own underwear. And she had at first almost completely and utterly ignored it, and she had simply and purely chalked it all up to a state of a dryness. But she had then decided to be able to mention it to me during her own annual wellness exam. And that one single and simple decision had then, quite literally, been able to save her very own life. And the very same bleeding that she had been experiencing had then turned out to be caused by a very early stage form of an endometrial cancer. And because Anna had then been able to seek out some professional care for this issue right away, her own personal course of a treatment had then been very straightforward, and her own personal outlook had then been very excellent. And today, she is a very healthy and a very grateful woman, and she had not at all been able to dismiss that one tiny and simple inconvenience. And the key and the essential takeaway here is a very simple one. If you are ever at all able to notice for yourself any kind of an unexpected form of a bleeding, of a spotting, or of a discharge in the years following the onset of your own menopause, please do not at all be sure to assume that it is nothing, and your very own body is, in fact, giving to you some very valuable and some very important information. And a great many women will so often hesitate to be able to do anything about this, all the while thinking to themselves that they are simply and purely overreacting, or that they are hoping that the problem will just simply and purely be able to disappear on its very own. But when it comes to the very important and the very integral matter of your very own personal health, the simple and the pure act of speaking up is never at all an overreaction. It is, in fact, a very powerful and a very profound form of a self-respect. And a very early form of a diagnosis will so often be able to mean a much less invasive form of a treatment, a much lower level of any kind of a complication, and a much, much better set of an outcome. So, please be sure to listen to that very same signal. Please be sure to trust your very own instincts. And please be sure to remember that you are your very own body's very best and very most powerful advocate. And now that we have been able to talk all about the subject of an abnormal form of a bleeding, let's now go ahead and move on to another very common and a very important symptom that will so often be able to slip right under the radar: a persistent and a prolonged state of a bloating or of an abdominal swelling. The experience of a bloating is something that most women are very familiar with. And perhaps it is able to come on for you right after you have had a very salty meal, or right after you have had a simple glass of a sparkling water, or at a time when your own digestion is just simply and purely feeling a little bit sluggish. And in all of those very same cases, the experience of a bloating will usually be able to pass in a matter of just a day or two. But when that very same bloating is able to become a much more frequent occurrence, when it is able to last for many, many weeks at a time, or when it is able to just simply and purely keep on getting worse, then it is most certainly a time for you to be able to pay a little bit of an attention to it. And the American Cancer Society is able to note that all of the many women who have been able to be diagnosed with an ovarian cancer will so often be able to describe their very earliest and their very most subtle symptom as just a simple and a pure sense of a fullness or of a tightness in their very own abdomen. And what is able to make all of this so very concerning is its very own persistence. And if your very own waistband is now beginning to feel so much more snug, even though you have not at all been able to gain any kind of a weight, or if you are now beginning to feel so very uncomfortably full, right after you have had just a very small and of a very simple meal, then please do not at all be sure to dismiss it all as just being a matter of your own age or of just simply and purely having a slowing metabolism. And in order to be able to picture all of this, I would like for you to please try to imagine for just a moment that your very own abdomen is like a beautiful and a delicate vessel, and an ordinary form of a bloating is very much like just a little bit of an air in that very same vessel. And you are then able to release that very same air, and the very same vessel is then able to go right back to its very own normal size. But with the condition of an ovarian cancer, a certain amount of a fluid can be able to build up in your very own belly, and that very same vessel is then able to stay in a very stretched and in a very expanded state, no matter what you are able to do. And one of my very own patients, Mary, had once been able to notice this very same kind of a bloating in her very own body, and she had then said to me, "Doctor, I just simply and purely feel so very puffy all of the time." And she had at first simply and purely assumed that it was all just a matter of a menopause-related form of a weight gain. But when her very same symptoms had then persisted for a very long period of time, she had then decided to seek out some professional care. And all of her many different and distinct tests had then been able to reveal the presence of an ovarian tumor, which had then been causing all of that very same fluid to be able to accumulate. And because Mary had been able to listen to her very own body and had then been able to come in to see me at a very early stage, we had then been able to intervene long before the very same disease had had a chance to be able to advance. The very next sign that I so very deeply and so very profoundly want for all of you to be able to watch out for is the presence of a pelvic or of an abdominal pain that does not at all go away. And the experience of a pain is a very complicated and a very nuanced signal, simply because so very many of us are so very used to all of the many different and distinct aches and cramps that are able to come along with our own lives. And you may have been able to live through many decades of a menstrual form of a discomfort, or you may now be living with a state of an arthritis or of a back pain. But the very same kind of a pain that is able to come from a gynecologic form of a cancer is a very different one. And it will so often be able to linger for a very long period of time. It will so often be able to feel so much deeper in your very own body. And it will also so often not at all be able to respond very well to any of the many different and distinct, simple and pure remedies. And according to the esteemed Mayo Clinic, both an ovarian and a uterine form of a cancer can be able to create a great deal of a pressure, of an inflammation, or of even just a simple and a pure form of a nerve irritation. That is then able to show up in your very own body as a form of an ongoing and of a persistent pain in your very own pelvis or in your very own lower belly. Now, please know that not at all every single kind of a pain is a dangerous one. And sometimes it can, in fact, be caused by a variety of different and distinct, benign and harmless conditions, such as some fibroids, some digestive issues, or even just a simple and a pure case of a constipation. And the real and the true difference is in the duration and in the intensity of that very same pain. And any kind of an occasional cramp that is able to ease up with a little bit of a rest is usually not at all a red flag. But if you are ever at all able to notice for yourself a form of a pain that is able to last for more than 2 full weeks, that is able to grow so much worse, or that is able to interfere with your very own daily life, then it is very much like a persistent and a very loud siren that will not at all stop ringing. And you may not at all be able to see the fire, but you should never, ever at all be sure to ignore the alarm. And alongside of a pain, another very early and a very important clue is the presence of some very significant and of some very dramatic changes in your very own urinary habits. And a great many women who are over the age of 50 are able to expect to have to deal with some kind of a bladder change. And you may now find yourself leaking just a little bit whenever you are able to laugh or to cough. Or you may now be in need of being able to get up at night so much more often than you had used to. And all of these very same things are, in fact, a very common and a very normal part of the process, especially in the years following the onset of your own menopause. But any kind of a sudden and an unexplained form of a urinary change, such as a feeling of the urge to be able to go constantly, of a having of a pain whenever you are able to urinate, or of a noticing of a pressure that is able to make you have to rush to the restroom, can sometimes be able to be linked to a gynecologic form of a cancer. And the National Cancer Institute is able to explain that all of the many different and distinct tumors that can be able to grow in your very own pelvis can be able to press up against your very own bladder, which in turn can be able to make you feel as though you are in need of being able to go, even when it is not at all full. And I would like for you to please try to think about your very own bladder as being like a very small and a very delicate reservoir. And normally it is able to fill up and to then be able to empty on a very predictable and on a very regular schedule. But if there is something that is able to press up against that very same reservoir, it may then be able to trigger a false alarm again and again and again. And if you are to suddenly and unexpectedly find yourself having to plan all of your own errands around a bathroom access, or if you are to suddenly and unexpectedly find yourself having to wake up multiple times at night, despite the very fact that you are not at all drinking any more fluids than you had used to, then it is most certainly a time for you to be able to check in with your very own doctor. And while all of the many different and distinct urinary tract infections are, in fact, the most common and the most likely culprit when all of your very same symptoms are able to persist, a further and a much more thorough evaluation is then necessary in order to be able to rule out something that is so much more serious. And what is able to tie all of these three very different and very distinct signs, the bloating, the pelvic pain, and all of the many urinary changes, together is the very fact that they are all so very easy to be able to dismiss. And a great many women will simply and purely be able to assume that they are all just simply and purely a part of the process of an aging or of a menopause. But I would so very deeply and so very profoundly want to be able to encourage all of you to be able to think of all of these very same symptoms as being like your very own personal internal alerts. And they do not at all necessarily mean that there is a major and a significant problem, but they should never, ever at all be ignored. And when you are able to catch all of these very same issues at a very early stage, you are then able to give to yourself the very best and the very most optimal chance for a simple and a pure form of a treatment, and for a strong and for a successful recovery. And to summarize, a persistent and a prolonged state of a bloating, of a chronic and of a debilitating pelvic pain, and of some very significant and of some very dramatic urinary changes are not at all just simply and purely some inconveniences. They are, in fact, your very own body's own personal way of being able to say to you, please be sure to pay some attention. And the simple and the pure act of listening to all of these very same signals can be able to make all of the difference between your being able to find a cancer at a very early stage, when it is at its very most treatable, and of your being able to find it far too late. And please be sure to remember that your very own personal health is a very precious and a very beautiful thing, and that you are so very deserving of the right to be able to feel so very strong, so very confident, and so very safe in your very own body. We have already been able to look at all of the many different and distinct signs of an abnormal form, of a bleeding, of a bloating, of a pelvic pain, and of some urinary changes. And the fifth and final warning sign that is so very deserving of your own personal attention is the presence of some very significant and of some very dramatic changes in your very own bowel habits, and an occasional and an intermittent case of a constipation or of a diarrhea is a very common and a very normal thing. And perhaps you have been able to eat something that is very unusual for you, or perhaps your own medications have been able to upset your own stomach. But if you are ever at all able to notice for yourself a brand new and a persistent change, such as a case of a constipation that is able to last for many weeks, of a case of a diarrhea that will not at all be able to resolve itself, or of a case of some stools that are now beginning to look so very different to you, in terms of their very own size or of their very own consistency, then it could, in fact, be your very own body's own personal way of being able to signal to you something that is so much more serious. And the National Cancer Institute is able to note that both an ovarian and a uterine form of a cancer can be able to press on your very own intestines, which in turn can be able to cause some very significant and some very profound blockages or a state of an irritation that are then able to show up in your very own body as a form of some very altered and of some very irregular bowel patterns. And I would like for you to please try to think of your very own digestive system as being like a very carefully and a very meticulously crafted timepiece. And normally, it is able to tick along with a very steady and with a very reliable rhythm. But when there is something that is able to press up against its very own gears, its very own hands may then begin to speed up. They may then begin to slow down, or they may even begin to stop altogether. And that is precisely why a sudden and an unexpected shift in how often you are able to go, or in how easy it is able to feel for you, is so very deserving of your own personal attention. And one of my very own patients, Carol, had once been struggling with a case of a constipation that she had thought was all due to a state of stress. But after several weeks of this, without any kind of an improvement at all, she had then come in to see me for an evaluation. And an imaging scan had then been able to reveal the presence of a pelvic mass, which had then been pressing up against her very own colon. And because she had then been able to speak up about it, we had then been able to treat her at a very early stage. And closely and directly linked to this is the sixth and final sign, an unexplained form of a weight loss or of a loss of an appetite. And a great many women who are over the age of 50 are able to work very hard to be able to maintain a healthy and a stable weight. And some of them are even able to be very pleased when the scale is able to drop without any kind of an extra effort on their part. But a form of a weight loss that is able to happen without any kind of a dietary change or of an exercise should always and at all times be investigated. And according to the American Cancer Society, the condition of an ovarian cancer will so often be able to cause a feeling of an early satiety, which simply means that you are able to feel very full, very quickly, even right after you have had just a very small and of a very simple meal. And this is able to happen when all of the many different and distinct tumors or a buildup of a fluid are able to press up against your very own stomach. And I would like for you to please try to imagine for just a moment that your very own stomach is like a very delicate and a very beautiful ecosystem. And normally, it is able to have plenty of a room for a full and a complete meal. But if you are to put a very heavy and a very dense object inside of that very same ecosystem, even just a few simple and pure apples will be able to make it feel very full. And that is exactly what is able to happen when a disease is able to take up a great deal of a space in your very own abdomen. And one of my very own patients, Susan, had at first been so very thrilled to be able to see 10 pounds of her own weight just simply and purely melt away, without any kind of a dieting at all. But when her own appetite had then completely and utterly vanished, and when she had then begun to constantly and to persistently feel so very fatigued, she had then been able to realize that something was not at all right, and all of her many different and distinct tests had then been able to confirm the presence of an early stage form of an ovarian cancer. And because she had not at all been able to ignore her very own symptoms, her own personal course of a treatment had then been highly and completely successful. And finally, let's now take a moment to be able to talk about the seventh and final sign, a persistent and a prolonged state of a fatigue. And the experience of a fatigue is one of the very most common and one of the very most frequent complaints that I am able to hear from all of the many women who are over the age of 50. And it is able to make a great deal of a sense between all of the many different and distinct family responsibilities, all of the many different and distinct changes in your own sleep, and the very natural and the very normal aging process. And the feeling of a tiredness is a very common and a very familiar one. But a cancer-related form of a fatigue is a very different one. And it will not at all be able to improve with a state of a rest, and it will, in fact, be able to linger for a very long period of time. And it will also be able to make even the very smallest and of the very simplest tasks feel so very overwhelming. And the National Cancer Institute is able to explain that all of the many different and distinct tumors that can be able to grow in your very own body can be able to drain your very own energy by the simple and the pure act of altering your very own metabolism, of a lowering of your very own blood counts, or of a triggering of a state of a systemic inflammation. And I would like for you to please try to think about your very own body as being like a very sophisticated and a very intricate internal power grid. And normally, you are able to recharge at night, and you are then able to wake up in the morning at a full 100% of your own power. But with a cancer-related form of a fatigue, it is as if that very same power grid is never at all able to charge up beyond a 30% level, no matter how long it is able to stay plugged in. And if you are to find yourself skipping all of the many different and distinct activities that you had once been able to enjoy, or if you are to find yourself struggling to be able to get through all of your very own everyday routines, despite the very fact that you are getting a sufficient amount of a rest, then it is most certainly a time for you to be able to ask your very own doctor to be able to look a little bit deeper into all of this. Now, it is very important for me to be able to stress that all of these very same symptoms, the bowel changes, the weight loss, the loss of an appetite, and the fatigue, do not at all always and at all times be able to point to a cancer. And they can, in fact, be caused by a variety of different and distinct digestive disorders, by some very significant and very profound thyroid issues, by a state of a depression, or even by just some simple and of some pure side effects of some of your very own medications. And what is able to matter the very most of all is the persistence and the change from your very own personal baseline. And you are able to know your very own body better than anyone else is. And if something is able to feel so very different to you and will not at all go away, then that is your very own personal cue to be able to seek out some professional medical advice. And by now, we have been able to cover all 7 of these very same warning signs: an abnormal form of a bleeding, of a bloating, of a pelvic pain, of some urinary changes, of some bowel changes, of an unexplained form of a weight loss or of an appetite loss, and of a persistent and of a prolonged state of a fatigue. And on their very own, they may at first seem to be quite ordinary, but when they are all taken together, or when they are able to last for a much longer period of time than you had expected, they are then able to form a very clear and a very direct pattern that should not at all be ignored. And please be sure to remember that your very own body is very much like a very wise and a very trusted mentor. And it will always and at all times be sure to try to tell you whenever there is something that is not at all right. And the real key here is simply to be able to listen to it and to be able to take some action. long before some very small and of some very subtle whispers are able to become some very urgent and of some very loud cries. When you are able to look at all 7 of these very same warning signs together, an abnormal form of a bleeding, of a bloating, of a pelvic pain, of some urinary changes, of some bowel changes, of an appetite or of a weight loss, and of a persistent and of a prolonged state of a fatigue, it can at first feel like a very long and a very overwhelming list. And you may even begin to wonder to yourself, how can I be able to tell the difference between a normal and an expected part of the aging process and something that is so much more serious? And that particular question is both a very common and a very important one. And the profound truth of the matter is that a great many of these very same symptoms can, in fact, be able to overlap with the symptoms of a menopause, of some digestive issues, or of even just a simple and a pure state of a stress. But what is able to make them so very different in the context of a gynecologic form of a cancer is their very own persistence, their very own newness, and just how much they are able to interfere with your very own daily life. And your very own body is able to have its very own personal language, and all of the many different and distinct symptoms that you are able to experience are its very own personal words. And at first, they may at first just sound like some very quiet and of some very subtle whispers. And they may be very easy for you to be able to overlook or to be able to brush aside. But if all of those very same whispers are able to continue day after day after day, they will then begin to become so much louder, and they will then be asking you to be able to listen. And I would like for you to please try to think of it as being like a small and a subtle indicator on the control panel of your own vehicle. And you may at first be able to ignore it for just a short and a simple drive, but if it is able to stay on every single time that you are able to start your own car, you will then be able to know that it is now time for you to be able to check the engine. And the very same is also true for your very own personal health. So, what should you be able to do if you are able to recognize for yourself one or more of these very same warning signs in yourself? Well, the very first and the very most important step that you can take is to simply and purely be able to schedule an appointment with your very own doctor. And you should then be sure to be very clear and to be very specific about what you have been able to notice. For example, instead of just simply and purely saying, "I am now feeling so very tired," you might instead be able to say, "I have now been feeling so very exhausted on every single day for the very past month, even after I have been able to get a full 7 hours of a sleep." And this very same kind of a detail is able to help your very own doctor to be able to understand whether or not a further and a much more thorough evaluation, such as some blood tests, some imaging scans, or a referral to a gynecologic oncologist, is now necessary. And the second step that you can take is to simply and purely be able to trust your very own instincts. And a great many women will so often hesitate to be able to bring up all of their many different and distinct symptoms simply because they do not at all want to be able to seem to be overly cautious. And other women may be told, it is probably nothing at all. And while it may, in fact, be nothing at all that is serious, it is always and at all times your own personal right to be able to seek out some answers for yourself. And the simple and the pure act of getting a second opinion is not at all being difficult. It is, in fact, being proactive. And the esteemed Mayo Clinic is able to remind all of their very own patients that a state of a persistence in the act of advocating for your very own personal health will so often be able to lead to a much earlier form of a diagnosis and to some much better outcomes. And the third step that you can take is to simply and purely be able to keep a track of all of your very own personal symptoms. And I would like for you to please try to write them all down in a simple and a pure notebook, or in a simple and a pure phone app. And you should then be sure to record for yourself just when they had first begun, just how often they are now able to occur, and whether or not they are now beginning to get any worse. And this very same simple and this very same pure act of a logging of your very own personal experiences is able to give to both you and to your very own doctor a much clearer and a much more comprehensive picture of all of this. And it can also be able to help you to be able to feel so much more in control. And it can also be able to reduce the very same anxiety that is able to come along with a state of an uncertainty. And it is also very important for you to be able to remember that a state of an awareness is not at all about the act of living in a state of a fear. It is, in fact, all about the profound and the beautiful process of being able to live with a sense of a confidence. And when you are able to know exactly what you should be watching out for, you do not at all have to be second guessing every single small and simple change that you are able to notice. And instead, you can then be able to recognize all of the many different and distinct patterns. And you can then also be able to make some very well informed and some very empowered choices for yourself. And a state of a knowledge is very much like a beautiful and a brilliant compass in a very dark and in a very unfamiliar territory. And it does not at all work to change the very landscape itself, but it does, in fact, be able to help you to be able to see very clearly so that you can then be able to move in a much more safe and in a much more effective way. And finally, let's now take a moment to be able to talk about the very profound and the very beautiful power of a sharing. And far too many women will so often suffer in a state of a silence, all the while thinking to themselves that all of their very same symptoms are all just simply and purely a part of the process of a getting older. But when you are able to share with other people what you have been able to experience, whether it is with your own friends, with your own sisters, or with even just your own daughters, you are then able to create a profound and a beautiful ripple effect of an awareness. And sometimes, the simple and the pure act of hearing another woman's own personal story is exactly what is able to prompt someone else to be able to seek out some professional care for themselves. And in fact, I would so very deeply and so very profoundly love for all of you to be able to reflect on this. Have you ever been able to notice for yourself one of these very same symptoms, and have then been able to wonder to yourself if it was at all normal? And by simply and purely being able to talk about it in an open and in an honest way, you may, in fact, be able to help another woman to be able to recognize her very own warning signs so much sooner. We have now successfully been able to walk through all 7 of these very same early warning signs of a gynecologic form of a cancer that all of the many women who are over the age of 50 must absolutely and completely not be able to ignore. 1. An abnormal form of a vaginal bleeding. 2. A persistent and a prolonged state of a bloating or of an abdominal swelling. 3. A pelvic or of an abdominal pain that does not at all go away. 4. Some very significant and very dramatic changes in your very own urinary habits. 5. Some very significant and very dramatic changes in your very own bowel habits. 6. An unexplained form of a weight loss or of a loss of an appetite. And 7. A persistent and a prolonged state of a fatigue. And on their very own, each and every single one of these very same symptoms can at first seem to be quite harmless or to be quite connected to your very own everyday life. But when they are able to appear in a very sudden and in a very unexpected way, when they are able to last for a much longer period of time than just a few short weeks, or when they are able to feel so very different to you from what you have ever been able to know before, they are then able to become some very meaningful and some very important signals. And by simply and purely being able to listen to all of those very same signals, you are then able to give to yourself the very greatest and the very most precious gift of all, an opportunity for an early form of a detection, at a time when a course of a treatment is at its very most effective, and when all of the many different and distinct outcomes are so much more hopeful. And according to the National Cancer Institute, the simple and the pure act of being able to catch all of the many different and distinct gynecologic cancers at a very early stage is able to significantly and dramatically improve your own personal survival rates. And it is also so often able to mean that you will be in need of some much less aggressive forms of a therapy. And that is precisely why your own personal sense of an awareness is able to matter so very deeply. I so very deeply and so very profoundly want for all of you to be able to carry this very same knowledge with a profound and with a beautiful sense of an empowerment, and not at all with a sense of a fear. And your very own body is not at all your own personal enemy. It is, in fact, your own personal partner, and it is also your very own lifelong companion. And I would like for you to please try to think of it as being like a very wise and a very trusted guide who has been able to walk with you through every single different and distinct stage of your own life. And that very same guide is able to communicate with you through a series of some very quiet and of some very subtle whispers, of some very gentle and of some very loving nudges, and sometimes even of some much louder and of some much more urgent shouts. And when you are able to notice a change, it is not at all a form of a betrayal. It is, in fact, a message. And the most loving and the most compassionate thing that you can ever possibly be able to do for yourself is to simply and purely be able to listen to it and to be able to respond to it. And over the course of many, many years, I have been able to see countless numbers of women be able to protect their very own personal health, simply and purely by the simple and the pure act of trusting their very own instincts. And one woman had been able to notice a little bit of a spotting after her own menopause, and she had then been able to mention it to her very own doctor, and she had then been able to catch a uterine form of a cancer at its very earliest and at its very most treatable stage. And another woman had been able to feel so very bloated for many, many weeks, and she had then decided to be able to ask for a scan, and she had then been able to find an ovarian tumor long before it had had a chance to be able to spread. And all of their very same stories are able to remind us all that a sense of a vigilance does not at all have to mean the act of living in a state of a worry. It is, in fact, able to mean the profound and the beautiful process of being able to live in a state of an awareness. And a state of an awareness is able to open up all of the many different and distinct doors to an early form of a care, to some much less invasive forms of a treatment, and to a great many more years of a healthy and of a vibrant form of a living. So, what should you be able to do as you are moving forward? Well, you should simply and purely be able to keep all of these 7 very same signs in your very own mind. You should simply and purely be able to pay a great deal of an attention to your very own personal baseline, to just how your very own body is usually and normally able to feel. And you should also then be able to notice whenever something is able to shift. And you should also then be sure to write down all of your very own personal symptoms, even if they may at first seem to be quite small and to be quite insignificant to you. And you should also then be sure to speak up at all of your very own doctor's appointments. And you should also then not at all hesitate to be able to ask for a sense of a clarity or of a second opinion. And all of these very same steps are not at all just purely medical ones. They are, in fact, all a profound and a beautiful act of a self-care, of an honoring of the very same life that you have been able to build for yourself, and of all of the many different and distinct people who so deeply and so truly love you. And as we begin to close, I would so very deeply and so very profoundly want to be able to leave all of you with this one final and very important reflection. Every single different and distinct stage of our own lives is able to bring with it some brand new and of some different challenges, but it is also able to bring with it some brand new and of some different opportunities for us to be able to protect and to be able to strengthen our very own personal health. And by simply and purely being able to be so very attentive and so very proactive, you are not at all only able to safeguard your very own future, you are also, in fact, able to inspire all of the many different and distinct women who are all around you, your own sisters, your own friends, and your very own daughters, to be able to do the very same. And together, we are all then able to create a brand new and a much more beautiful culture where all women are able to listen to their very own bodies and are also able to trust their very own instincts. And if this particular video has been able to give to you something that is very valuable today, I would so very deeply and so very profoundly want to be able to encourage all of you to be able to share it with another woman in your very own life. And you may never at all be able to know just whose very own story it may be able to change. And if you would like to be able to stay connected with all of us, then I would be so very grateful if you would please be sure to subscribe to this particular channel. And we will be sure to continue to be able to bring to all of you some very trusted and of some very evidence-based health guidance that has been specifically and carefully designed for all of the many women who are over the age of 50. And finally, I would so very much love to be able to hear from all of you. Which of all of these 7 very same signs has been able to surprise you the very most? Please be sure to leave a comment down below, because your very own voice and your very own story are able to matter so very much. And please be sure to remember this: your very own personal health is a very precious and a very beautiful thing. Your very own personal instincts are very powerful, and your very own future is so very much worth protecting. And together, by simply and purely being able to listen to our very own bodies, and by simply and purely being able to support one another, we can all be able to face all of the many different and distinct years that are still ahead of us, with a great deal of a strength, of a clarity, and of a profound sense of a confidence. I'm Dr. Lily Stones, and I thank you for your time. And before we close, let me remind you this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.